good to see so many folks in the middle of the room. So I'm going to jump right in. I only have 25 minutes, and so I want to get started. But first I want to say I come from Silicon Valley, and sometimes you get really absorbed when you're in Silicon Valley, but it's so great to think about if we want to really advance healthcare, we really have to find innovation hubs that really span across the US. So it's great to see everyone here, and it's great to think about Nashville as that next innovation hub. This is a little bit about what I'm going to talk about today. I'm going to talk about anywhere care and about what that vision is. So I'm going to take a glimpse into the future. And then I'm going to take a look at a survey that we did and share some of that data with you. And then I want to talk about the challenges behind the view of anywhere care and talk about some of the technologies that are helping advance us towards that vision. So let's start by thinking about someone with a chronic condition. Let's call her Amy, and let's say that she has type 2 diabetes. Today, Amy's efforts to stay physically active, maintain a balanced diet, and monitor her stress levels are analog and disjointed. But we are approaching an era, well, soon, that will be digital and integrated. So let's take a glimpse into a day in a life when that's possible. So Amy's alarm clock wakes her up at 5:30 in the morning, and her smartphone gives her a customized exercise routine. It's 30 minutes of cardio and 15 minutes of strength training. After that, Amy steps on her Wi-Fi-enabled scale and takes her blood sugar measurement from an attachment on her smartphone. Immediately, her fitness dashboard is updated, and simultaneously, that data is sent to her physician. Amy then goes to her refrigerator, and she's going to make breakfast. She gets a notice that she's a half-pound heavier than the day before. And she gets a suggestion to make a power green smoothie for breakfast, and it's a recipe that her nutritionist has provided. Her smart refrigerator then notifies her local grocery store, and the ingredients are restocked. Later that day at work, Amy's smart watch notices that her heart rate is a little higher than normal. And it probably has something to do with the presentation that Amy's giving later in the afternoon. So she gets a suggestion to take a yoga class during lunchtime versus the stress eating that she usually does at McDonald's down the street. So this view is really something that we thought wasn't really possible several years ago. But we think about this consumer-driven transformation that's in healthcare that a lot of us think are catalyzed by the ACA. So it really makes this vision a possibility in the near term. So today I could have spoken about a lot of technologies that are kind of my pet areas. I love virtual reality for behavior modification, smart pills for med adherence. But today I want to talk about anywhere care, and I want to make a pit stop on that trajectory to anywhere care and talk a little bit about telehealth. And kind of erroneously, the terms telehealth and telemedicine have been used interchangeably. But John Halamka actually says that the definition of telemedicine is really difficult to put into a bucket. If we think about telemedicine, the video teleconferencing between physicians in a consult, or that between a patient and a provider in an exam, or between physician groups is considered telemedicine. If we think about transmission of a static image, like a rash to a dermatologist, or the use of text messaging for coordination of care, or even being able to aggregate information from a patient's digital device and being able to transmit that to a physician, those all really fall into the bucket of telemedicine. And if we distill that, we can think about telemedicine being virtual clinical care. Telehealth is a little bit of a broader umbrella. Telehealth encompasses training, continuing education, and administrative services in addition to clinical services. So now that we have those defined, let's move on. And I'd like to share some of the data in a consumer survey that Xerox conducted, trying to understand consumers' views towards telehealth and telemedicine. So when we did this survey, I think you're going to find that the results pretty interesting. When we asked people how likely were they to engage in telehealth, we had a surprising response. 61% said that they would be interested in getting non-urgent advice, exams, and consulting through virtual health services. When we asked, so everyone's pretty keen about this. When we asked them how many of them had actually engaged in virtual health, only 16% had. So for us, it really illustrated a really huge adoption gap. And for the entrepreneurs in the room, I mean, this is an unmet need, right? This is the opportunity for a market pull. For us, we really saw this as a responsibility to respond to a demand in the market. So I want to go a little bit deeper and talk about what some of the data that was behind this. So when we asked folks, what is it? What are you excited about? 77% said that they were excited about the possibilities of what virtual health or telehealth really brought. And we wanted to break it down, and we asked them, what are those top things that excite you? The first, and I apologize, I lost my glasses, so I have to. The first was convenience. 59% of them said that the convenience of telehealth was attractive. 40% potential cost savings. 35% being able to see a professional for minor ailments. 35% easy refill of prescriptions. And 26%, the ability to see a professional more frequently. So if you really just kind of boil that down, it's really about cost and ease. So we also wanted to get behind what are the concerns around virtual health. The first was their insurance wouldn't cover it. So again, that kind of goes to that cost element. 37%, their data is not secure. 35%, they won't have a personal relationship with their provider. 34%, kind of the technology or connection issues. And 30%, they won't have access to the regular physician. And just recently, the advisory board released some data around telehealth and found that the consumers were really concerned about the quality of the interaction. So this really kind of bolsters that. So the first thing I want to do is kind of dig a little deeper into the adoption gap and really try to understand what's behind that and in terms of the challenges that we can address. The first I want to talk about is regulation, and then I'll talk about utilization and privacy concerns. So when we talk about regulation, coming from healthcare, I think about that being tied really closely to reimbursement. And the advances in research and the paradigm changes around technology, services, and new healthcare delivery has really shown that globally, regulatory agencies have had a difficult time keeping pace with development. And if you really think about it, and they have a good grasp on privacy and security, but when it comes to areas beyond that, globally, regulatory agencies are really having a difficult time keeping up. So for example, if you think about mobile health or mHealth, and when we look at Europe and the US, there are kind of two general categories with which people are classifying mobile health. If you look at one, it's around diagnosis, treatment, and prevention, which are medical apps. And a whole nother category is around wellness, lifestyle, and fitness, and those are non-medical apps. But with the changes and the way we have around a patient-centric model, clinical or medical intended use is really blurring those lines. I'd say in the US, there's a sentiment that the 40-year-old FDA framework is really not a good fit for HIT. HIT is around agile development now. It's around research collaboration and thinking about a focus on clinical outcomes. A lot of naysayers actually say the FDA really doesn't have the depth required to be able to play in HIT. But while these agencies are kind of trying to figure this out, entrepreneurs are really taking advantage of the fact that if they get FDA approval, they really have a market advantage. or if they decide to go the route of not getting FDA approval, they have the opportunity to agilely develop inside the market. But however you slice it, if you have some type of technology or service that has a high price tag, you have to think about the fact that regulatory approval is the first step towards reimbursement. And you actually have to play in that sandbox. So if we think about what's going on with regulatory and reimbursement, it's certainly a little bit murky. So the second challenge is around utilization. And if we think about that adoption gap that we showed at the beginning, and we think about that as a proxy, there's certainly a challenge around utilization. When we think about telehealth, again, the advisory board published a recent piece that talked about the fact that those of us in telehealth really are thinking about it as a technology. And having been in healthcare for a number of decades, a lot of times we approach these things where we have a technology and that's a hammer and everything's a nail. And we really need to start thinking about telehealth and these virtual health services as trying to figure out how we solve some of the problems that exist in telehealth. And at Xerox Healthcare, we were really interested in telehealth around 5 years ago and really did a survey of this industry. And it's been really interesting to me because a lot of companies that use utilization as the heart of their business model have either gone under or have pivoted. So utilization in terms of the way we think about it really has to change. And kind of hearkening back to some of our early business school lessons, this is a new technology, and we don't really see one company out there kind of owning this telehealth space. And I think it's going to be a niche market approach, and we're already seeing elements of that, where we see telehealth vendors playing in behavioral health, stroke, post-discharge, and I think it's going to be this element that Clayton Christensen calls this upmarket march, where we're going to find pieces of these niche markets that we're going to be able to dominate, and then we're going to be able to scale. So we really have to think about telehealth in that manner. And an entrepreneur that I talked to recently actually said, telehealth or adoption is not a technology problem. Adoption is a behavioral problem. So whenever we have a new opportunity in this space, I think we have to think about awareness and education, both on the physician as well as the patient level. So the next area I'd like to talk about is privacy and security. With this, I think there's a lot of baggage I could bring, but I want to keep kind of storage and stewardship of patient information kind of off the table. But when we think about privacy and security, you think about all the headline news that we've been hearing in 2015 and 2016, and it's probably not a surprise that this has made the top list of challenges with telehealth. I read a report recently, and it stated that 45% of consumers have had some of their personal information breached in some type of healthcare cyber attack. And Ponemon Institute released a report in 2015 that said 90% of physicians have been involved in some type of data breach over the last 2 years. So I think we're really in the age of the data breach. And I suspect that it's only going to get worse. If you talk to a CIO of a healthcare company and ask them what keeps them up at night, I think you'll find two things. One of them is how to be compliant with all the regulations and policies and still remain effective and efficient. And the other is how are they going to respond to some type of data breach. So what's interesting, because this is such a hot topic, we're actually seeing a lot of research in this area. There's research in cryptography, de-identification, tokenization. But one of the things I'm really excited about in terms of research in this area is blockchain. And I'm going to actually use blockchain as my pivot to be able to talk about what I think are the technologies on the forefront that are actually enabling us in telehealth. And those are blockchain, APIs, and the cloud. So as I mentioned, I'm going to start with blockchain. I'm actually really curious, and I'd love to ask, how many folks in the audience have at least heard about blockchain in telehealth or in healthcare? Okay, that's not bad. I think what's really interesting is we're actually starting to see the discussion. So blockchain comes out of the financial industry, and most of the things that have been going on in healthcare have been hypothetical, but innovators are now starting to act on those things that used to once be hypothetical. And the blockchain can actually serve to help protect us from data breaches. So information is, and they can do that through multi-signatures and cryptography. That's a mouthful. And information or data is hashed to the blockchain, and then it's not accessible until you have the appropriate number or amount of signatures. And so the information can't be changed on the blockchain, and it can't be accessed without permission. And I think what's exciting about blockchain is that it's really nascent in the healthcare industry. And because of that, some of the things that we're seeing in the financial industry in terms of the use of blockchain, there are really relevant applications in healthcare. So one of the things about blockchain is it has some, and those of you who want a primer on blockchain should actually go to YouTube. There's some really good stuff that we can teach you about what blockchain can do. But because of some of the nascent characteristics of blockchain, it could potentially make HIE obsolete. So with blockchain, you don't need a third party to actually verify the worthiness of someone accessing the information. Because you can eliminate the middleman, that gives us the opportunity to more safely guard the information and make it accessible in a much more timely, resource-efficient manner. And if we think about medical information, EHRs are really not set up for conditional consent. So if a patient wants access to their medical records or medical information, they either have to opt all in or all out. And that really doesn't meet a patient's needs. You know, the beautiful thing about blockchain is the platform is centralized, but the information, or in this case, medical records, are decentralized. So with the signature of the hospital, the patient can add their signature and get access to the information or the type of information that they need at the right time. So it finally puts the patient in control of their medical records. So another technology or platform that we can borrow from other industries is applied programming interfaces, or APIs. And that comes over from primarily what we see in the financial and travel industry. So those of you who booked a trip recently probably went to some website, maybe Expedia.com, and you had the opportunity to research your hotel, your flights, and probably a rental car. And the information was displayed concisely and neatly side by side, and you were able to do all of your research and what we call shop, book, and pay. So you were able to do that to fit your needs and probably your budget. So what's interesting is your last healthcare experience probably couldn't be further from that. I'm guessing you probably had to pick up the phone, you probably were put on hold and had to listen to some horrible music. When you actually got into your appointment, you had to physically produce a card, probably had to fill out some insurance forms and answer some type of health intake survey for the 1,000th time. When you were done, you probably got home, you got all these mailings, it was really difficult to tell what's a bill, what's not a bill, and you probably had no idea how much you owed. So that's onerous, but behind the scenes in another parallel universe, the physicians are going through the same, or a very similar trauma. They've got to submit your claim, either manually or digitally. They have to have it go to a clearinghouse that kind of scrubs everything. Then it may go to your provider, and it may get faxed back and forth between your provider, the payer, maybe get faxed back and forth to fill out whether it's medically necessary, whether you actually needed a referral, and it's just a nightmare until it finally gets in the queue to be paid. So this is a fat, antiquated set of conditions, a nightmare for the provider, and as a consumer or a patient, you're completely left in the dark in terms of the whole billing structure. So I've heard someone actually call this, or make an analogy, it's like going to Nordstrom, shopping blindfolded, and getting the bill 30 days later. I mean, we wouldn't accept that. So what APIs do is it unlocks these data silos and allows communication. There's no excuse for why healthcare shouldn't look like booking a vacation, shop, book, and pay. So I'd be remiss if I didn't talk about the cloud. The cloud has really enabled a lot in healthcare and continues to. If we think about the cloud, it has given us on-demand access to computing and storage facilities. It allows interoperability between physicians and health systems across geographies, and it allows data sets for EHR, radiology, and genomics. In 2014, we really thought the cloud was about storage and HIE. I think we didn't realize the power was really at the heart of the patients being in control or consumerization of healthcare. What it really has done, if we really just kind of net it out, it's allowed HIT to be at a cost that allows us to fuel telehealth, and it'll continue to be that telehealth infrastructure. So I've given my view of what's going on in anywhere care, and particularly telehealth, the challenges and what we have to look forward to in terms of the technologies that are really pushing us forward. I'd like to just give a shout out to healthcare companies that are really starting to push the periphery there and make us realize that this transformation is going on in healthcare. At the top of my list was Glimpse, but Glimpse just got acquired by Apple, so I don't think they qualify as a startup. But I do want to talk about just a few, and I really look forward to getting to know several more here over the next couple days. One of them is Spruce. They're a 5-star app in the area of dermatology, and you can download that app free from the App Store, and it allows you to have a relationship with a dermatologist for just about $40. The other is Livongo. I think they're tipping diabetes care on its head. I'm always really interested in business models, and they've changed the whole business model around type 2 diabetes. It's not based on strips any longer, and they actually connect the data that they have to care teams and research teams with real-time intervention. So excited about them. The other company I really like is PocketDoc, and what they've done, if we think about the API interfaces, they've built this framework that allows developers to create new apps and services for healthcare. So those are just a few of the companies that are kind of on my list that I love to track and follow. Xerox Healthcare is not in healthcare delivery per se, but we see our job as kind of being that backbone to help startups scale and help them really be able to focus on their core areas to transform healthcare. So thank you again for having me today. I again look forward to talking with you again over the next several days and learning a little bit more about what's going on in the healthcare ecosystem. Thank you.